Hello, dear friends. Very warm welcome to all of you. Our beautiful, amazing platform. Myself, Dr. Shrikant Verma. Yes, we are going to talk our one very important, difficult, but very interesting topic, that is the functional column of the cranial nerve nuclei. I want to request to all of you, please watch our previous video. Yes, what is the name of our today's topic? Your answer is functional column of cranial nerve nuclei. As always I say, मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. Break the name. Yes, it is the functional. Definitely it will control the function of what we are going to see. Column. These are arranged in a vertical column of what, sir? Cranial nerve, but not the cranial nerve axon, but we are talking about the cranial nerve nuclei. Okay, beta. So we are going to continue this beautiful, amazing session. Just one quick recap of our previous video. We talked in our yesterday class for the first MBBS students. What is the nucleus? Sir, nothing. Collection of the cell body within the CNS, nucleus. Next question. What is the ganglion? Yes, collection of the cell body outside the CNS, known as ganglion. What is the tract? Nothing. Bundle of the axons. In simple word, that is the tract. I told you what is a pseudoganglion. Yes, ganglion like structure, but not made by the nerve, but made by the fat. That is known as the pseudoganglion. Okay, sir. In the next part, I told you the different cranial nerve nuclei, they are arranged in a particular manner. The God created the body in a beautiful way. Our formula was 2244. I told you one song. Yes, एजी ओजी लोजी सुनो जी, मैं हूं मन मौजी, करता हूं मैं जो वो तुम भी करो जी. 1 2 का 4, 4 2 का 1. My name is Lakhan. Yes, in the similar way, here for the cranial nerve nuclei, you have to remember 2 2 का 4 4, 4 4 का 2 2. So this is the your formula magic. Yes, first 2 cranial nerve, no nuclei. Next 2 cranial nerve means third and fourth midbrain nucleus. Then next 4 5 6 7 8 pontine nucleus, and then 9 10 11 12 they are having the nucleus in the medulla. Okay, after that I told you this beautiful creativity of the God. Yes, the cranial nerve nuclei 3 4 6 and the 12th, they are in a vertical column within the brain. Yes, these are having the similarity. These cranial nerve 3 4 6, they are supplying the muscles of the our what, sir? Muscles of the our eyeball, extraocular muscle. These are derived from the somites, so you will say somatic, and these are showing the movement. Movement means efferent, so these are responsible for the our somatic efferent. Yes, so beautiful magic. All the cranial nerves which are derived from the somatic, yes, all the cranial nerves which are supplying the somites muscle and which are responsible for the movement, yes, they are arranged in a particular vertical column. सो अमेजिंग क्रिएशन बाय द गॉड. भगवान ने हमारी बॉडी को बहुत खूबसूरती के साथ बनाया है. ऐसे क्रेनियल नर्व जिनका एक जैसा फंक्शन है, वो एक कॉलम में अरेंज है. ये है आज का टॉपिक, फंक्शनल कॉलम of what we are going to talk about the cranial nerve nuclei, not the fiber. And when you are reaching on the lateral side, then in yesterday class I told you the cranial nerves which are supplying the spatial viscera. Who is the spatial viscera? Sir, pharyngeal apparatus. So remember the cranial nerve of the 5th nucleus, then 7 9 10 also the 11, they are having the same kind of the function. All are supplying our, yes, nucleus, all are supplying the spatial viscera, pharyngeal apparatus. So these are arranged in a vertical column. कमाल की बात है, जादू हो गया. ऐसे क्रेनियल नर्व जिनका एक जैसा फंक्शन है, वो एक कॉलम में अरेंज है. हमने कभी सोचा ही नहीं था. यस, दिस इज द फंक्शनल कॉलम ऑफ क्रेनियल नर्व न्यूक्लियाई. एंड व्हेन यू आर गोइंग अवे, तो बेटा यहां पर क्या आ रहा है? यस, हियर इज द आवर सेंसरी नर्व, 5th cranial nerve. And when you are going lateral most, there is the 8th cranial nerve, which is coming from the spatial, yes, our ear, hearing. Yes, it is derived from the our otic capsule. Fine. So this is our ectodermal region. Yes, it is the our spatial somatic, and it is sensory inactivity means efferent. So I am going to teach you the spatial somatic efferent which is lateral most. Yes. So this all the cranial nerves, ये ऐसे ही इधर उधर आड़े तिरछे अरेंज नहीं है. These cranial nerves are arranged in a particular column beautifully they are arranged, the beauty of the God, yes, which are having the same kind of the function. So this is our topic. Hope you all are getting the point. Now look further. This is the image which we are observing in our textbook always. Sir, these are the our cranial nerve nuclei. These are arranged in the column. We are going to talk about it. So yesterday, yes, today we are going to talk about this all. Yesterday I told you the basic principle. The central nerve system, it is derived from the neural tube. The cranial part is making the brain. The caudal part is remaining the narrow. That is our spinal cord. We had cut the spinal cord transverse section. So do you remember? In our transverse section of the spinal cord, the inner layer is ependymal layer. Around it, the cell bodies are collected. So that is the mental layer. And around the mental layer, there is the margin part. Yes, white matter of our brain. So that is the marginal layer. Yes, the imaginary line, sulcus limitans, was passing. And our formula, our concept was that, sir, above the sulcus limitans, this part is known as alar lamina. And always, alar lamina gives rise to the efferent nerve. Also you can say sensory nerve. So our formula was, yes, yaad karo beta, AAA. So easy. So just opposite to it, Bell-Megendi law, physiology integration, thumb rule. Below the sulcus limitans, correct sir, below, this part is known as basal lamina. Yes, our mnemonic is B for below, B for basal lamina. And it is, yes, giving rise to the motor nerve. Motor nerve is also known as the efferent. ओके सर, तो अब हमारा फंडा बन गया, कॉन्सेप्ट बन गया. सल्कस लिमिटेंस के ऊपर जो है वो हमेशा सेंसरी नर्व को ओरिजिन देगा, एफरेंट नर्व को ओरिजिन देगा, और सल्कस लिमिटेंस के नीचे हमेशा 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 मोटर नर्व का ओरिजिन होगा. एग्री एवरीवन? गेटिंग द पॉइंट? ओके सर. So after that we had seen there are the changes in the our, yes, spinal cord. Fine. So this our ependymal layer, it is making the central canal. The mental layer, it is making the our gray matter, and the marginal layer is making the our white matter part. And the different kind of the cranial nerves we are getting derived. So can you revise this all the thing? Yes, we had seen this all the thing, and we created the formula also. Sir, this was the our spinal cord. Fine. So I am just again revising this factor for today's class. Yes, sir. You can see that all the cranial nerves are arranged in a particular column. So yesterday, just one quick revision. Then we are moving for the today's INICET NEET PG. This all kind of the question. Try to understand further. Sir, we had seen there is the our, yes, central canal. Around this central canal, there was the our gray matter. Yes, sir. And it was having the lateral horn. Correct, sir. So just tell me beta, yes sir, this is the our white matter portion. Yes sir, this is our white matter portion. Got the point? Now check this one. Sir, you told the gray matter is around the central canal. So this is the gray matter area. Also you can say, sir, it is our, yes, mental layer, and here is our, yes, the margin portion, the marginal layer. Getting the point, everyone? Yes sir. So just try to understand. Yesterday we had seen the sulcus limitans was passing from the center of the central canal. So different cranial nerves were there. Just tell me, this is which function? Yes, break the name and get the idea. Sir, this particular part, it was supplying to the our structures which are derived from the somites or ectoderm. So you will say somatic. Yes, this is below the sulcus limitans. Below the sulcus limitans means it is efferent. Yes sir, it was our efferent. It is not supplying any special structure, especially the branchial apparatus. Who is special viscera? Sir, branchial apparatus, pharyngeal apparatus is special viscera. So sir, it is the general. So you will say, sir, general somatic efferent. So what is the title? GSE. Are you getting the point? Never get confusion. Again I am revising GSE. Okay, we given the name GSE, gusse. Okay sir. Now in the similar way, the nerve which is derived on the our dorsal root is sensory, means efferent. Yes, it is carrying the impulse, it is bringing the impulse from the our structures derived from the somites. Yes, or you can say ectoderm. So you will say, sir, this is our what? Sir, somatic. नाम को समझो बेटा. Somatic का मतलब क्या है? Sir, somites also you can say, sir, the part which is derived from the ectoderm. For what we are using the term somatic. Visceral means which are derived from the our viscera. Okay, sir, somatic. And then it is sensory or motor. Sir, it is above the our sulcus limitans. Then definitely it is your efferent. Okay, yes, sir. It is supplying to the special viscera branchial apparatus? No. So what you will say, sir? It is normal, means general somatic efferent. In short, the nickname we given the general somatic efferent. One quick revision. Agree everyone? Getting the point? Okay, sir. Now we had seen, sir, this was the lateral horn. And lateral horn was supplying to the viscera. Okay. So the collection of the gray matter here and there. Yes, sir. So the collection of the gray matter just in front of the lateral horn, it will supply to the viscera. What viscera? Viscera of the body. So this is our what, sir? Visceral. Yes, it is below the sulcus limitans. That's why you will say, sir, efferent. So this is our visceral efferent. Now can you tell me it is what kind of the visceral efferent? General or special? Sir, it is not related with the pharyngeal apparatus. That's why you will say, sir, this is our general visceral efferent. In short, GVE. And in the similar way, sir, here is another nerve nuclei. So what you told, sir, this was our again visceral. Yes, sir, that is our visceral, and it is sensory or motor. Sir, it is behind, it is above the sulcus limitans. Then definitely you will say, sir, it is our efferent. So it is coming from the pharyngeal apparatus? No, sir. Pharyngeal apparatus is spatial viscera. So don't say the spatial visceral. It is coming from all over the body. That's why you will say the general visceral efferent. So what is your formula? General visceral efferent, GVA. Okay. We discussed this all the thing in our previous class. This is just one quick revision. Now after that I told you in between that our somatic and the visceral, one more column develops at our brain stem part which is supplying the pharyngeal apparatus. So I am drawing here that structures in between that both column. So what should be the nomenclature? Yes, sir. It will supply to the spatial viscera, pharyngeal apparatus. So spatial visceral. Yes, it is efferent or efferent because it is below the sulcus limitans. That's why you will say efferent. Yes. So this is our efferent. Spatial viscera is supplying. Yes, it is supplying the pharyngeal apparatus. Pharyngeal apparatus is spatial viscera. In the fishes, in the gills, this pharyngeal apparatus is better known as the branchial apparatus. So we are using the term branchial efferent. So in short, BE, also you can say SVE. I think there is no problem. And the another column which developed here. Yes, this is the quick revision we had seen in our previous class. So this is our efferent part. So what you will use? Efferent or efferent? Sir, definitely efferent. It is carrying the impulse from the our spatial viscera or general part. Sir, coming from the pharyngeal apparatus. So definitely you will say, sir, this is our spatial visceral efferent, SVA. Also you can say branchial efferent. Okay, sir. So in this way, you can observe what are the different nucleus is general somatic efferent, then branchial efferent, then spatial visceral efferent, then there is the, yes, that branchial efferent and spatial visceral efferent both are same, then general visceral efferent, then there is the our sulcus limitans, you can say the mirror. So mirror term are there, sir, general visceral efferent, then spatial visceral efferent, then general somatic efferent. So we had drawn the image with the opening of the our, yes, brainstem part. I told you that formula. Can you recall? Again, for you all, just one quick revision. Sir, there is the development of the our neural tube, CNS development. So this is the our, yes, you can say the neural plate, neural groove, neural tube. There is the anterior neuropore, posterior neuropore. So this is the neural tube formation. Yes, it is at the midline. So the cranial part of this neural tube, it is giving origin to the brain. The caudal part of this neural tube remains narrow, which is known as the spinal cord. Okay, sir. So the upper part of the spinal cord, yes, sir. The spinal cord, lower part, yes, upper part. The upper bulb-like dilated part of the spinal cord is known as medulla. So when you will see the medulla from the below, it is closed, it is rounded. But when you will see the medulla oblongata from the above, sir, it is open. So When you will see the medulla from the front, there is the midline elevation, pyramid, lateral elevation, olive. But when you will see the medulla oblongata from the back, you will see one V-shaped depression. बेटा आपको एक V-shape का depression नजर आता है. Sir, this is our floor of the fourth ventricle. Getting the point? Yes. So the upper part of the medulla is not closed, but it is open. So this is the sequence. Yes. Do you remember general somatic efferent? Okay, sir. Then branchial efferent. Okay, sir. Then general visceral efferent. Then sulcus limitans is acting like the mirror image. Yes. Sulcus limitans. Below is the basal lamina, which is giving origin to the efferent. And above the sulcus lamina, there is the LR lamina above efferent. So just to use the mirror term, general visceral efferent, so general visceral efferent, branchial efferent, so branchial efferent, general somatic efferent, so general somatic efferent. So just this is the sequence. Now after that, yes, I told you the formula also, how to remember. The sequence is gusse, be, gue, gua, ba, gussa. Getting the point? Yes. Gusse, be, gue, gua, ba, gussa. And later there is a development of one another column. So I told you the central canal is closed. So there is the our elbow joint which is acting like the our sulcus limitans. So below this hinge joint, below this our elbow joint, gusse, be, gue, 3 columns, and above this hinge joint, gua, ba, gussa. Getting the point? Okay. And at the last one more column is developing, that is a spatial somatic efferent. It will carry the spatial sensation. What are the spatial sensation? I will tell you. Yes, vision, smell, taste, and hearing. This will be related with the our, yes, the vision, the smell, and our eighth cranial nerve, hearing. But we are talking about the nucleus, so eighth cranial nerve will develop here. So it is latermost. Okay, sir. So gua, ba, gussa, gua, ba, gussa, and sasa. But this is getting open. Okay. So at the midline, the motor nucleus, and at the lateral side, the sensory nucleus. So what is the sequence? Gusse, be, gue, gua, ba, gussa, sasa. Okay, so we had seen this all the things in our yesterday class. This all was this any kind of doubt, beta, you can ask na, without hesitation. Yes, Dr. Ishfaq, good evening, beta. Yes, Vishal, good evening, good evening. Okay. Yes, Vidhi, good evening, beta. So this was our quick revision of the yesterday class. Okay. Now try to understand further. Okay, sir. So now we are going to look for the our today's session. Yes. So catch this point. For again proper understanding, you have to know the few terminology. Sir, whenever we are using the word general, means it is just all over the body. You can take this thing all over body. It is not special. And whenever you are using the word special, means our branchial, also you can say pharyngeal apparatus. Always this term will be used. Yes, then you have to know what is the our, yes, somatic. Somatic means the structures which are derived from somites. Also you can say the ectoderm. Yes, the viscera. The meaning of the viscera, yes, you can say the structures which are inside. Yes, somites or ectoderm, you can say the structures which are outside or at the surface, but viscera, they are inside of the body. You cannot touch. Okay, sir, fine. Now you have to remember what is the efferent. Efferent means sensory, and what is the efferent? Efferent means motor. So this is the your basic concept. Without the knowledge of this, you cannot crack this INICET question pattern. Yes, I told you one more thing, the formula. Sir, SAME. Sir, S for sensory, A for efferent, sir, M for motor, and E for, yes, efferent. Okay, fine. Hope you all are getting the point. So now we are going to look what are the cranial nerves, nuclei, which are asked in our exam. Fine. So try to catch this all the things, sir. We are going to look what are the different cranial nerve nuclei which are located at the midbrain, and these are having this sequence. Fine. So again, I am going to write down sir, the our brainstem opened, so it was showing such kind of the structure. Yes, this is the our, you can say, the open part of the medulla. Here is the sulcus limitans, this is the lateral part. Yes sir, and the same structure is here, but we are not drawing on the opposite side. Okay sir, this is the location of the what, sulcus limitans. This is the location of our sulcus limitans. Getting the point? So we all had seen there is the our cranial nerve nuclei, gusse, be, gue, and then motor, gua, ba, gussa, and at the last one more, sasa. So we are going to talk about this all. Yes, about this all the different kind of the cranial nerve nuclei. Fine. So I am putting their name in this box. So catch this point, sir. The first cranial nerve column which we had seen, sir, this was our general, because it will not supply to the special viscera, pharyngeal apparatus. So this is the general. Yes, it will supply to the structures which are outside the body, which are derived from the somites. Yes, which are motor. So general, somatic, efferent. Got the point? So first column is general, somatic, efferent. You can give the nickname gusse. What is the nickname, sir? We are giving the nickname that is the our gusse. Fine. Now I told you, after that gusse, there is the next cranial nerve nuclei that will supply to the pharyngeal apparatus. So this is motor or sensory, sir, motor. So you will use the term branchial, efferent, column. Agree everyone? Getting the point? Yes. Asin beta, love you beta. Thanks for your such kind of the love and the respect. Okay sir. So gusse, and the next column for your mnemonic is be. Okay. Now, do you remember this one? Next column, sir, gusse, be. Then next column will supply to the viscera, general viscera or special viscera. Sir, only one thing is special, that is a pharyngeal apparatus. Already you had written. So this will be the general viscera. So this is general visceral. It is motor or sensory, sir. It is the motor. Yes. Here is the location of the our sulcus limitans. So I am writing, I am using the color red color. This red color is showing the our sulcus limitans. Yes sir, this is our sulcus limitans. So can you tell me the next one will be? Definitely sir, that will be our efferent. So these blue color are showing the efferent. Okay, so what is this? This next was gusse, be, gue. Then you will see it will supply to the our, not the pharyngeal apparatus, it will supply to the our normal structure. So general what, sir? Mirror image. This is the visceral, general visceral, efferent. So just mirror you have to use. So general visceral, not E but A. So general visceral, efferent. Yes. So we are giving the nickname also gusse, be, and this is the gue. So here is the what, sir? This is the our gua. Then next column, can you tell me beta? We revise in our yesterday class. Please watch our yesterday class before our today's session. Okay, you will get better understanding. Fine. So this is our, yes, gua. It will supply to the pharyngeal apparatus, branchial apparatus. That's a branchial. What you will use? The efferent or efferent, sir? Behind the sulcus limitans, efferent. So this is our branchial efferent. So the nickname you will give, sir, ba. Gusse, be, gue, gua, ba. Okay, and then you will use the one another one. Okay, that is our, yes, general. It will supply to the general structure. So general, it will supply, yes, it will carry the sensation from the structures which are derived from the somites. Also you can say, sir, the ectodermal part. So you will say, yes, GS, general, somatic, and definitely efferent. Fine. Now later there is a development of one more column, that is our very special structure, special sensation. Yes, like the hearing, like the vision, like the smell. So special. Then these are derived from the somites or ectoderm. So you will say somatic. Don't use the viscera term. Yes, it is motor or sensory. Sir, after the sulcus limitans, everything is efferent, efferent, efferent. So you will use the term efferent. Now one magical thing, one good thing, that sir, these two columns, the general visceral efferent and the branchial efferent, both will get united together. Okay, so catch this point. I am using one more table for all of you here. Sir, this is our special somatic efferent. Fine. Now catch this point, sir. The nickname, yes, gussa, and this is our sassa. So just few nickname, few mnemonics also. Okay, sir. So now we are having the clear concept about the sequence. This is the one very important recent INICET question. What are the our sequence? So you can say, sir, gusse, then be, then gue, then gua, then ba, then gussa, and then sassa. So no excuse with this our sequence. Agree, beta? Fine. Okay. What I want to tell you, this all the structures before the sulcus limitans, these are motor, and after the sulcus limitans, sir, these are sensory. Okay. One more very good thing, yes, I will teach you that general visceral efferent and branchial efferent both will get fusion. Fine, sir. We are clear in this all the concept. Now what are the cranial nerves? Now use the common sense. First, general somatic efferent, which cranial nerve nuclei are located? So just think about it. Sir, it is medial most in the our brain stem. Okay, sir. It is medial most. Fine. Can you see? It is medial most. It is somatic efferent. Definitely it will supply to that cranial nerve. Yes. That structure which are derived from the somites. That's a somatic. And this will be motor. Yes. Now tell me, this is the brainstem part. Which structures are derived in this our head neck face portion, which are derived from the somites and which are motor, means muscles? Only one answer you will get, sir. The extraocular muscles of the eye. Yes, these our rectus muscle, oblique muscles. Fine. So they are developing from the somites, extraocular muscle, as well as muscles of the tongue. Do you remember we learned that the muscles of the tongue, they develop from the occipital somites because they are developing from the somites. That's why you will say somatic, and these are motor. That's why efferent. So the muscles of the tongue, and what are the nerves of the tongue muscle? Sir, 12th cranial nerve. So remember your formula for this area. So what you have to remember, sir? Formula for this general somatic efferent is our, yes, extraocular muscles and our tongue. Otherwise, in more easy way, I am writing here the eye. Remember, don't count the your sphincter pupillae, dilator pupillae, because these all are viscera. We are talking about the somatic. So now tell me, beta, which cranial nerves are supplying the extraocular muscle and the tongue muscle? So your answer, sir, the third cranial nerve. Fine. It is located in the our, yes, midbrain. Fine. Then, sir, fourth cranial nerve. Yes, it is located in the midbrain. All extraocular muscles are supplied by third cranial nerve except SO4 and, yes, superior oblique by the fourth cranial nerve, and LR6, lateral rectus, is supplied by the our sixth cranial nerve. And I told you the formula 2244. So this sixth cranial nerve is located in the pons. Got the point? So I am writing here, sir, this is our third cranial nerve. Correct, sir. Here is the fourth cranial nerve. This is the sixth cranial nerve. These are supplying our extraocular muscles. And remember another muscle group at this our head and neck face area, which is derived from the somites. That is a tongue muscle. Yes, tongue muscles are derived from the occipital somites. Also, you can say occipital myotome, except palatoglossus. Yes, we had seen in our embryology class, but right now, yes, and the nerve of this part is 12th cranial nerve. That's why all the muscles of the tongue, they are supplied by what? Yes, answer is a 12th cranial nerve. Do you remember the Hilton law? जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. So you will say the same thing, sir. 12th cranial nerve, and the 12th cranial nerve nuclei is located in the our, yes, medulla. So this is our 12th cranial nerve. So in exam, INICET, NEET PG exam, they will ask that which cranial nerve nuclei are having the general somatic efferent. Now, खत्म, टाटा, बाय बाय, गया. लप्पू सा एग्जाम है, झिंगूर जैसे क्वेश्चन है, यूं ही क्रैक कर देंगे. व्हाट यू टू रिमेंबर नाउ? यस, द गुस्से, गुस्से में आंखें और जीभ दिखानी है. So you will recall immediately, yes, eye muscle and the tongue muscle, and the eye muscles are supplied by the 3, 4, 6. All the extraocular muscles are supplied by the third cranial nerve except SO4, LR6, and the tongue muscles, they are supplied 12th cranial nerve. खत्म बेटा, इतना ही याद रखना, इससे ज्यादा कुछ नहीं पढ़ना है. So first column, the 3rd, 4th, 6th, 12th. Now see, that's why look the beauty of the anatomy. I told you the first column. That's why. Can you see where is the third cranial nerve? Sir, here is the third cranial nerve. Can you see? This is the our third cranial nerve. And the fourth cranial nerve is coming from the behind and then running within the cranial cavity on the front. So its cranial nerve nuclei is located deeply at this side, deep side. And can you see the sixth cranial nerve? Sir, this is the sixth. And can you see the 12th cranial nerve? Sir, this is the 12th. So amazing. You can observe this third, fourth, sixth, 12th. Sir, these are arranged in a same vertical column. सर यही तो हमारा टॉपिक है. These 3, 4, 6, 12th, these are showing the same kind of the function. Functional. These are arranged in a same column. Functional column. Yes, these are the nuclei of the cranial nerve. So what is the name of the topic? Sir, the topic name is the functional column of cranial nerve न्यूक्लियाई. भगवान ने हमारी बॉडी, हमारे क्रेनियल नर्व्स को ऐसे ही नहीं बनाया, बहुत सोच समझ के बनाया बेटा. आज तक हम कभी नहीं समझ पाए कि ये क्रेनियल नर्व ऐसे ही अरेंज नहीं है, हैफजार नहीं है. दे आर शोइंग वन पर्टिकुलर अरेंजमेंट. होप यू ऑल आर गेटिंग द पॉइंट बेटा. यस यस यस, फाइन. Yes, Asin is saying, sir, I am first year students. Your previous lecture was amazing. Thank you, Asin. Thank you, beta. You are getting the point. So this is the very big gift for me. Thank you, beta. Okay. So what I want to tell you, sir, this is our first cranial nuclei column. Okay, sir. Fine. Now, sir, come to the next. Look for this our branchial efferent. Break the name and get the idea. So next cranial nerve nuclei we are going to understand. Just remember, break the name, get the idea. मिर्जा गालिब कहते हैं, सारे राज नाम में दफन रहते हैं. Definitely it will supply to the pharyngeal apparatus, branchial apparatus. Okay, sir. And it is our efferent, motor nerve you have to count. Yes, they will show the motor activity. Yes, branchial apparatus is spatial viscera. So you can say the spatial visceral. Yes, efferent means E. So this is nothing. This is the spatial visceral efferent. So just tell me, what are the cranial nerves which are related with the pharyngeal apparatus? So what is the trick? Sir, these are the our, yes, pharyngeal nerves. So I am going to tell you the mnemonic. After this concept, I am going to tell you the mnemonic also. So the mnemonic will be the pharyngeal nerves of the our body. So just tell me, the first arch is having the, yes, mandibular nerve. The second arch is having the facial nerve. Then third arch is having the glossopharyngeal nerve. Fourth arch was having the 10th nerve. Yes, the 10th nerve is assessed by, helped by the 11th nerve. So that's why this complex is known as, yes, you can say our, you can say the vagus nerve plus accessory nerve. So vago accessory complex. What I want to tell you, sir, the nerve of the pharyngeal apparatus. So there is our mandibular nerve. Yes, this is the fifth cranial nerve. So you will draw in the our pontine part. Okay, sir. Then I told you the nerve related to the our second arch. Yes, facial nerve, that is also located in the our pons. And then the nerve of the third arch, that is a glossopharyngeal nerve. It is located in the medulla oblongata. and then 10th cranial nerve, it is also located in the medulla oblongata, and then our 11th cranial nerve, the cranial root, because you are talking about the brain stem, so cranial root, yes, it is also located in the our medulla oblongata. So what are the different cranial nerve, sir? This is our mandibular nerve, nerve of the first arch, then sir facial nerve, nerve of the second arch, then our glossopharyngeal nerve, the nerve of the third arch, and then our 10th nerve, sir, this is the nerve of the fourth arch, and we all are aware vagus nerve is assessed by, yes, helped by our 11th cranial nerve, and we all are aware, sir, these three cranial nerves, yes, they are presenting one common nucleus, the common nucleus of the 9th, 10th, 11th. This is known as, yes, can you recall, sir, nucleus ambiguous. So this is our nucleus ambiguous, one very another hit question. So remember, in your exam, the question will be asked, what are the different cranial nerve which are counted under the, yes, branchial efferent or special visceral efferent. They will give the option 3, 4, 6, 5, 7, 8, 9, 10, 11, 12, whatever. What you have to remember, sir, branchial efferent, special viscera means branchial apparatus, and you have to count the motor nerve. So what are the nerves, sir? The mandibular nerve, the nerve of the pharyngeal arch. Yes, you have to apply the pharyngeal nerves. So it's easy. Yes, nerve of the second arch, facial nerve, nerve of the third arch, glossopharyngeal, nerve of the fourth arch, vagus nerve. We all know that vagus nerve is assessed. It is helped by the 11th cranial nerve. So our, yes, accessory nerve also. Fine. Which root? The accessory nerve is having the two roots, cranial root and spinal root. Sir, the cranial root, because you are talking about our cranial nerves, you are talking about our brain stem. So the root which is coming from the brain, yes, spinal root is below, it is coming from our spinal segment. So don't count the spinal segment, talk about our cranial root. Vagoaccessory complex, the pharyngeal plexus, we talked in our embryology part. So right now we are not going there, na? Okay, sir. Now we are coming for the next way. You have to think about our pharyngeal. You have to think about the cranial, our head, neck, face part. Yes, visceral, efferent. Now try to think. It should be the viscera. Okay, sir. Means you cannot touch from the outside. These are not derived from the ectoderm. These are not derived from the your, yes, you can say, sir, somites. It is visceral. Means it is inside. Okay, sir. What are the structures? Yes, and efferent. Efferent means motor activity. Now try to understand here in our body, within the eye, there is the constriction and dilatation. And remember, there is the our, yes, constriction in sphincter pupillae, which is controlled by the third cranial nerve nuclei. And that is our parasympathetic part of the third cranial nerve. Yes, it is our muscle and it is showing the constriction movement. So it is efferent. So the cranial nerve which is coming from this our part, yes, it is not the somite, na, it is viscera. Okay, fine. So, and it is not the special viscera because it is not related with the pharyngeal apparatus. So our Edinburgh Westphal nucleus, which is the part, yes sir, which is the part of our this third cranial nerve. So you will say Edinburgh Westphal nucleus, MCQ. Fine. Every point is the MCQ. Okay, sir. Now try to understand any other viscera which is showing the motor activity. Yes, sir. There are the glands. Yes. There is the our lacrimetry gland. Yes. There is our, yes, you can say the salivation gland, submandibular, sublingual, parotid gland. Also the GIT gland, which is not located in the head, neck, face part, but yes, it is located in the GIT. These all are the viscera. Yes, glands are the viscera. These are not located on the body part. Na? These are the viscera. And they are showing the secretion. And secretion is motor activity or sensory activity. Sir, it is motor activity. Do you remember in our bullet train anatomy, I taught you the secretomotor pathway. Secretion is the motor activity. So just you have to count about the nucleus which are controlling the secretion. So one by one, let's start. Sir, in our pons, there is location of the superior salivatory nucleus and inferior salivatory nucleus. What I told you, sir, these are our superior salivatory and inferior salivatory. Fine. Few textbooks, they are saying the upper part of the superior salivatory nucleus is the lacrimal nucleus. Fine. Yes, what I want to tell you, sir, these are our, you can say, the superior salivatory nucleus. I told you, as for superior salivatory nucleus, as for sublingual gland, as for submandibular gland, they control the secretion of the sublingual and submandibular gland. And few textbooks, they are saying the upper part of the superior salivatory nucleus, that is our lacrimal nucleus. And this lacrimal nucleus, it will control the viscera. Which viscera? Sir, lacrimal gland. So what you will say? This is your, yes, controlling the lacrimal gland activity. Fine. And this is our inferior salivatory nucleus. I am not including that parasympathetic motor secretor pathway. Go at our YouTube channel. There is our, yes, bullet train anatomy 7 hour 30 minutes. Completed entire NEET PG anatomy. So there I taught you the secretomotor pathway. Yes, this inferior salivatory nucleus, it is related with the secretion of what? Sir, secretion of the parotid gland. Yes. And these are the part of which cranial nerve? So again I want to tell you, sir, this Edinger-Westphal nucleus, it is related with the our what? Third cranial nerve. Correct, sir? Edinger-Westphal nucleus, it is related with the our what? You can say the third cranial nerve. So general visceral efferent, which cranial nerve? Third cranial nerve, but only the Edinger-Westphal nucleus. Remember the remaining part of the third cranial nerve, it is coming in the general somatic efferent. Now the lacrimal nucleus and superior salivatory nucleus, sir, actually these are the part of our, yes, facial nerve. Fine. And the inferior salivatory nucleus, sir, it is nothing, it is a part of the our glossopharyngeal nerve. Getting the point? And you can remember in the medulla one large nucleus of the vagus nerve, which is controlling the GIT gland secretion. So here is our dorsal nucleus of the what, sir? This is our dorsal nucleus of the vagus, D and V. Okay, sir, this is our vagus. Again, I am showing here. Do you remember the secretomotor pathway? Also, you can say the parasympathetic ganglion of head, neck, face. At that time, I taught you the 4 ganglion. Sir, the first was ciliary ganglion. Please go for the our, yes, bullet train anatomy first. Second, I taught you, sir, there was the our pterygopalatine ganglion. Okay. Then I taught you submandibular ganglion, and also I taught you the otic ganglion. At that time, I told you the GIT ganglion is also, but that GIT ganglion are not part of the head neck face. But right now we are including, sir, GIT parasympathetic ganglion. Okay. Yes, we are talking about the what? Parasympathetic, not the sympathetic. So can you recall, sir, this ciliary ganglion was under control of the which cranial nerve? Third cranial nerve. Especially which part? Sir, Edinger-Westphal nucleus. Sir, this is your, yes, general visceral efferent nucleus, integrating both the things. Pterygopalatine ganglion, it was responsible for the allergic response, lacrimation, nasal secretion, yes, salivary secretion. Getting the point? Palatine secretion. So this was related with the our facial nerve. Yes, which nucleus? The lacrimal nucleus. Do you remember? Yes, the submandibular ganglion, and as well as, yes, this was submandibular ganglion. It was related with the secretion from the our, yes, submandibular gland as well as sublingual gland. So it was related with again the facial nerve. Getting the point? Yes. Otic ganglion, yes, it was under control of the inferior salivatory nucleus, which was under control of the glossopharyngeal nerve. Do you remember? Yes. And GIT ganglion, that is related with the 10th nerve. Fine. So in this way, can you observe, sir? 3. Both are 7, na? 9, 10. These are nothing. These are our, yes, parasympathetic cranial nerves. You can remember. Fine. These are related with the general visceral efferent. Yes. These are not related with the pharyngeal apparatus, so you cannot say the spatial viscera. Fine. These are showing the secretion or motor activity. That's why efferent. You cannot touch them. These are inside the body, so you cannot use the term somatic. It is the visceral. Agree, everyone? Getting the point, beta? Fine. Okay, sir. So now try to understand further. Yes, sir. The submandibular gland, it is related with the our superior salivatory nucleus. Yes, sir. And this ninth nerve is related with the inferior salivatory nucleus. And this is the dorsal nucleus of the vagus. So I am giving one more mnemonic. This is your left side. What you will say? Left side. L for lacrimatory nucleus. S for superior salivatory. I for inferior salivatory. D for dorsal nucleus of the vagus, and E for Edinger-Westphal nucleus. So getting the point, everyone? What I want to tell you, sir, here in this category, I told you the concept, and now I am going to tell you the mnemonic. That is your, yes, left side. So what is the L? Sir, L for lacrimatory nucleus. Sir, S for superior salivatory nucleus, I for inferior salivatory nucleus, D for dorsal nucleus of the vagus, and E for Edinger-Westphal nucleus. Very important question. Fine. Okay, sir. Now look for the our GUA. Yes, general visceral efferent and the branchial efferent. So here is the one good news for all of you. What? Both are friends. Both are getting fused. So these are getting fused together during the evolution. So can you tell me any structure? Yes, which is having the general visceral efferent activity as well as branchial efferent sensory activity. Yes, you can say the spatial visceral efferent. Just tell me, beta, any structure in our body which is carrying the general sensation as well as spatial sensation. Can you tell me, beta? Yes, yes. Try to answer. Any structure? Okay, sir. It is sensory. Fine. It is general viscera. Means it is inside. As well as it is related with the pharyngeal apparatus. Only one structure in our body. Yes. Which is having the spatial sensation. What is the spatial sensation? Sir, smell. Sir, vision. Sir, hearing. And sir, taste. But remember, the vision means retina. Sir, it is ectodermal. So you cannot say the spatial viscera. It is ectodermal, that's a somites. Sir, our smell pathway, this is also coming from the ectodermal part, neuroepithelium part. Yes. And hearing, sir, otic capsule, it is also the ectodermal part. Fine. So what you have to remember, these all are somatic. Yes, the vision, it is spatial, but it is somatic. Sir, smell, sir, it is a spatial sensation, but it is somatic. Sir, our auditory activity, hearing, sir, it is spatial sensation, but it is not the your, yes, spatial visceral. It is not the viscera, it is somatic. So what is remaining? Tongue. Now focus over the tongue. I taught you earlier, sir, tongue, anterior two-third, posterior one-third, and posterior most part. Sir, the anterior two-third, it is taking origin. Yes, it is derived from the first arch, and here is the our third arch, and this is the fourth arch. Sir, tongue is carrying the, yes, catch this point, understand this point, make the concept, pain, temperature, touch. Yes or no? Yes, sir. When you are using the hot coffee, yes, you are dropping over the tongue, so tongue will tell it is, yes, hot. Yes or no? Yes, it will tell about the pain in the tongue. Yes, there will be the pain when hot coffee is coming. And yes, you can touch, you can know. So tongue is carrying the general sensation. Yes, sir, these all are our general sensation, means efferent. Agree, everybody? But you know how much amount of the sugar is added. So tongue will tell you about the taste also. Sir, taste also. So taste is nothing. This is our spatial efferent. Only one viscera in our body. Yes. Which is showing the general efferent, spatial efferent, both. Yes, spatial viscera, because the tongue is derived from the our pharyngeal apparatus. So remember, the two columns are fusing together and it is participating in the tongue formation. Now just tell me, what are the cranial nerves which are carrying the taste sensation? Sir, anterior to third, this taste sensation is carried by the chorda tympani, which is the branch of what? Facial nerve. Yes, the posterior one third, it is having the taste sensation by the our what? Sir, this is the our posterior one third, the taste sensation by the glossopharyngeal nerve, and the posteriormost the vagus nerve. So these three cranial nerves you have to count under the category of, yes, what? Under the category of the general visceral efferent as well as the branchial efferent. So what you have to remember, sir? These two, yes sir, these two, our facial, then ninth and then 10th, these are carrying the general sensation, yes, tongue part, fine, and also you can say the our special sensation. Now also remember, sir, these are united together and making the one common nucleus. That common nucleus is known as taste pathway. So nucleus tractus solitarius, yes sir. So this 7, 9, 10, these are nothing. These are the our common nucleus. Cranial, we are talking about the nucleus. That's a nucleus tractus solitarius. This pathway is known as the tractus solitarius. So one mnemonic also, sir, NTS. You can say the NTS. In short, N for 9, T for 10, S for 7. Getting the point? So 9, 10, 7. What you have to remember? 9, 10, 7. Getting the point? So which cranial nerves are under the our, yes, general efferent, yes, general visceral efferent and the special visceral efferent? Your answer is the 9, 10, 7. That is the nucleus tractus solitarius. And these are located where? Sir, remember, the seventh nerve is located, sir, the seventh nerve is located in the pons, but our 9 and 10 in the medulla. Fine. So this is nothing. This is our nucleus tractus solitarius. The upper part 7th, then 9th, and then lower part 10th. Okay, sir. So the trick, the gua and the ba, your answer is yes. Sensation from tongue. Remember, beta, tongue was included there also, but this was a tongue motor muscles. But here the tongue sensory activity, not the motor, but sensory. Okay, sir. Now look, we are going to talk about our next column, general somatic efferent. Yes, yes, yes. Look here. That's why first vertical column, and then I talked to you about this our second. That's why in our body, look here. First column we discussed. Can you see the second column? Sir, there is the our fifth cranial nerve. This is the our thickest cranial nerve. So it is having the cranial nerve, fifth. Then here is the our facial nerve. Yes, sir, facial nerve nuclei at the deep. Getting the point? Then can you see there is the our ninth, 10th, and there is our 11th nerve. Getting the point? So their cranial nerves are located in one another. Yes, you can see the vertical line. So this is nothing. They are controlling the function. Yes, sir. They are arranged in a bar, in a column. Correct, sir? Function column of what? Sir, these are the cranial nerve. And we are talking about, not about the axon, but we are talking about the our nucleus, deeply located, the collection of the cell body. These are arranged in a same one another vertical column, which is laterally. Getting the point? Fine. Now you can see, sir, the fifth cranial nerve, it is having the motor and the sensory. So fifth cranial nerve is having one more nucleus, sensory, which is lateral. Yes. So we are going to talk about this, our component of the fifth cranial nerve, which is sensory. Look here, beta, sir, general somatic efferent. Yes. Break the name, general. Okay, sir. So it is outside. It is normal. Somatic, yes, somites or the ectoderm. Okay, sir, it is outside. It is not the viscera. Efferent means sensory. You're talking about our head, neck, face part. So just tell me, just touch your face, and can you tell me which cranial nerve nuclei can show such kind of the phenomena? Only one. The sensory nerve of the head, neck, face part, sir, that is our trigeminal nerve. And earlier I taught you, again I am teaching you, sir, you taught us nucleus ambiguous is equal to the common nucleus of the 9th, 10th, 11th. MCQ. MB means common, and I told you the nucleus tractus solitarius. Yes, N for 9, T for 10, S for 7. I told you the concept also, na? Okay. Yes, taste pathway. You can say the taste pathway. Okay, sir. Now I am going to tell you the fifth cranial nerve, nucleus. So catch this point. Sir, the largest cranial nerve, fifth cranial nerve. Sir, the largest cranial nerve, nuclei, the fifth cranial nerve. So look, observe. Suppose this is our midbrain. Here is the pons and this is the our medulla oblongata. Agree, sir. I am just showing the color coding. Sir, the midbrain showing with the brown color, the pons showing with the green color, and then medulla, sir, it is our yellow color. So fifth cranial nerve is the largest cranial nerve. It is having the two types of the nucleus. Yes, the sensory nucleus. It is located in the our pons. Yes, sorry, motor nucleus. Motor nucleus is only located in the pons, one motor nucleus, but it is having the three sensory nucleus, and this sensory nucleus is very big. The sensory nucleus is very big. It is extending in between the midbrain, then pons, and then medulla oblongata. It is reaching up to the our spinal cord. Yes. So what you will say? Yes, we are going to look for the name. These are showing the three parts. The first part which is within the midbrain. Another part which is located in the our pons. And our another one more portion which is going towards our spinal cord. Yes. So the sensory nucleus is having the three different parts. What I want to tell you, sir, fifth cranial nerve, it is having the two types of the nucleus. Yes, motor nucleus and sensory nucleus. We are looking for the top level MCQ asked in our, yes, you can say the INICET pattern. So just to see, the motor nucleus is located in the pons. Yes, it is located in the pons. Fine. Khatam, tata, itna hi yaad rakhna hai. But now we are going to talk about the sensory nucleus. It is having the three parts. First, second, third. Sir, the first part is located in midbrain, second part in the pons, and third part is going to the our medulla spinal cord. Yes, you can say medulla up to the spinal cord. Getting the point? Fine. Yes. Now look. Because it is in the midbrain, so you will say the mesencephalon, mesencephalic nucleus of what? Sir, trigeminal nerve. We are talking about the sensory nucleus. Yes, the biggest nucleus is the pontine nucleus. So it is the chief nucleus. It is the sensory nucleus. It is the pontine nucleus. It is the principal nucleus. Different name, different textbook, different author. We are using the term, sir, chief sensory nucleus of what? Sir, trigeminal nerve. Okay, and this is reaching towards the spinal cord. So what you will say, sir, this is our spinal nucleus of what? Trigeminal nerve. So easy. So totally you will observe one motor and three sensory nucleus, total four nucleus of the trigeminal nerve, the largest cranial nerve, and the cranial nerve which is having the biggest nucleus, and the cranial nerve with the maximum number of the axons, the thickest cranial nerve. सबका मालिक एक है. आपका आंसर क्या है बेटा? फिफ्थ cranial nerve. Agree बेटा? Fine. Okay. So hope you are getting the point. Now try to understand further. Catch this point, sir. We are going to give the nickname also, M and T. Just give the name M and T. Mantu. Yes. And then you are giving the nickname C and T. So can you say this one? C and T. Kantu. Okay, sir. And this is your spinal nucleus of trigeminal nerve. So you will say S and T. Santu. Okay. So this is the story of the trigeminal nerve. Sir, Mantu, Cantu, Santu, mesencephalon, nucleus of the trigeminal nerve. Sir, chief nucleus of the trigeminal nerve, and spinal cord nucleus of the trigeminal nerve. So mesencephalic nucleus of the trigeminal nerve, the chief sensory nucleus of the trigeminal nerve, and spinal nucleus of the trigeminal nerve. So in this way, you can remember, sir, fifth cranial nerve, it is having the one motor and three sensory nucleus. Agree, sir. One motor nucleus, no special name, it is located in the pons, and three sensory nucleus, you can say the Mantu, the Cantu, and the Santu. Getting the point? Remember beta, this mesencephalic nucleus, sir, it is located in our midbrain portion. So when we are performing the jaw jerk, so the impulse is going through the our mandibular nerve part, and then again with the pseudo unipolar neuron, it is coming directly here. So remember, the jaw jerk is related. This is the your INICET question. So remember, the jaw jerk is related with our Mantu. Yes, this is the chief sensory nucleus, and this chief sensory nucleus is performing the chief activity. Yes, what are the chief activity here? Sir, the chief activity here in the our face part is pain, temperature, touch. Getting the point? Okay. So remember, this all the activity are performed by our chief sensory nucleus as well as spinal nucleus of the trigeminal nerve also. Getting the point? So these are the different points, but that jaw jerk portion had been asked. Yes, the center is our mesencephalic nucleus of the trigeminal nerve. Yes, while the our pain, temperature, touch, these are carried by our chief sensory as well as the spinal nucleus of the trigeminal nerve. One more question had been asked, that is our yes, sense of position, proprioception. So sense of position, yes, remember, this proprioception is reflex pathway. We know in our physiology the monosynaptic reflex. Yes, I told you, टोन है तो पॉस्चर है तो इक्विलिब्रियम है तो मूवमेंट है तो हम है. And at that time in our cerebellum chapter, I taught you that the basics of this all the muscle tone, posture, equilibrium, movement. This is the integration with the physiology as well as the medicine. Yes, the basics are the muscle spindle, the monosynaptic reflex, and it is the reflex. Reflex is close to the spinal cord. So remember, spinal nucleus of the trigeminal nerve. Sir, it is the center. It is the center for the what? Sir, it is the center for the proprioception mainly. So these are the very top level MCQs. The questions are your nucleus ambiguous, INICET question, yes, NEET PG question, 9, 10, 11. MB means common, amphibian, common, yes. Then nucleus tractus solitaris, N for 9, T for 10, S for 7. And the fifth cranial nerve, I told you the one very detailed concept, and then I told you one short and sweet. Yes, one motor nucleus in the pons, three sensory nucleus in the midbrain, in the pons, and in the spinal cord. So you will say the Mantu, Cantu, Santu, the INICET top level question. The Mantu is the classical example, yes, of the efferent, then cell body, then immediately, yes, there is the our efferent, and then efferent, general anatomy. So when you will see from the distance, you will see unipolar, but when actually closely you will see it is having the two poles. So this is a pseudo unipolar. So the classical example of the pseudo unipolar neuron is found in our body. That is a mesencephalic nucleus or trigeminal, which is the center for the jaw jerk, physiology, and the medicine. While the pain, temperature, touch, these are carried by our Cantu and the Santu. Okay, if you have to opt one answer, then best is your yes, chief nucleus, but reflex, sense of position, proprioception, sir, it is carried by the spinal nucleus of the our trigeminal nerve. Hope you are getting this all the very high quality of the MCQs. Okay, sir. So what I told you, sir, these all fifth cranial nerve, they are carrying the impulse from our body surface. Yes, ectoderm part, correct, sir, skin. So you will say somatic and sensation. So what you will say, sir, this is the very long cranial nerve nuclei located in the our yes, midbrain, medulla, as well as pons, and yes, there is the our chief nucleus at the yes, which portion, sir, pons. So this is the our just relative diagram. Upper part mesencephalon, midbrain, the middle part, yes, our pontine, and this part is going to the our medulla. So what you have to remember, sir, this is our what, Mantu, this is our Cantu, and here is the sun too. So these all are the general somites sensory nerve. Fifth cranial nerve. Which cranial nerve? Fifth cranial nerve. Only the sensory part. Remember, the fifth cranial nerve motor part you counted here. The mandibular nerve, the branchial efferent. Okay. Now last. Catch this point. That's why. This is the lateral part. That's why in our body, again I want to tell you the same dialogue. That's why I want to tell you the fifth cranial nerve, sensory part, is lateral most. The first column, sir, the first column was the third, yes, then fourth, then sixth, and then 12th. Yes, third cranial nerve nuclei, fourth cranial nerve nuclei here, then sixth cranial nerve nuclei, and this is the 12th cranial nerve nuclei. So this is the our first functional column. This red color is showing the second functional column, and yes, they are having the different more things which are distributed here. Fine. Then the fifth cranial nerve is here. Sensory part. I am talking about the what? Sir, sensory part. And now come to the lateral most. Can you see the lateral most is our vestibulocochlear. Now try to understand again this amazing fact, sir. Look the sequence, sir. You are now I'm going to talk about the our, yes, you can say the spatial somatic efferent. We are going to talk about our spatial somatic efferent. It is spatial. Sir, what is the spatial? Yes, vision, smell means first cranial nerve, and vision is the second cranial nerve, taste and hearing. Now try to understand. You cannot talk about the tongue. Why? Because tongue, it was the example of the general visceral efferent plus branchial efferent. Both we are fusing. Okay, sir. So exclude this one. So what are remaining? Sir, your answer is first. It is spatial. Fine. Yes, it is derived from the somites. First, smell. It is related to the skin, ectodermal. Yes. As well as you can say it is sensory. Yes, smell sensation. And then second, sir, it is our spatial. Yes, it is spatial sensation. Yes, the retina, which is responsible for the vision. Vision is a spatial sensation. It is neuroectodermal. It is ectodermal. So somatic. And it is sensory or motor. Sir, vision is sensory. So second cranial nerve. And hearing, yes, means eighth cranial nerve. Getting the point? Okay, sir. Means the cranial nerve nuclei of the eighth cranial nerve, this is the vestibulocochlear nerve. So the nucleus is vestibulocochlear nucleus. Fine. Got the point? Okay, sir. It is spatial function. Hearing is the spatial function. Somatic. Yes, the vestibulocochlear apparatus, it is derived from the otic capsule, which is the ectodermal. Fine. So it is somatic. Efferent because it is sensory. But now try to understand, there is the no first and second nucleus. Do you remember? Yes, that formula 2244. I told you that first and second, no nucleus. These are having the axons. Yes, the olfactory nerve and second means optic nerve. They are not having the nucleus, sir. That's why remember you're talking about the functional column of the cranial nerve nuclei. You are counting about the cranial nerve nuclei. So remember, don't count this first, don't count this second. These are not having the nucleus, but the eighth cranial nerve, sir, it is having the nucleus. So only one cranial nerve which is having the nucleus. Answer is the eighth cranial nerve. So what you have to remember, sir, spatial somatic efferent, the our vestibular nucleus as well as the cochlear nucleus. Yes, there are the our different nucleus which you learn in your ENT Dhingra. There is our dorsal cochlear nucleus, ventral cochlear nucleus, vestibular nucleus. They are also having the different part. Yes, it is located at the pontomedullary junction. So these are the points. Remember, first and second cranial nerves, these are not having the nucleus. So they will create the problem. Yes, question will be asked in your exam. The question will be asked: spatial somatic efferent fibers are present in option A, B, C, D. They will put the option like the, yes, first, second, third. They will put the option first, second, 7. They will put the option like the first, second, 8th. They will put the option like the 8th. So they are talking about the fibers. Now, one more question. Yes, special somatic efferent. Nucleus. Example. Again, your options are same. A, B, C, D. First, second, third. Can you tell me the answer? Yes. B में first, second, 7. C, first, second, 8th. Then 8th. So just put your comment. Can you tell me what should be the answer? These are the two different questions which will create the confusion. Anyone? Answer in the comment box. Okay, because they are asking about the fiber. Fiber means axon. They are not asking about the cell body collection. So in this situation, you will say, sir, 8th. Correct, sir? But axons means second and first is also right. So this is correct answer. But when they are asking about the nucleus, sir, first and second, they are not having the nucleus. 8th is having the nucleus. So answer will be the D. Yes, very good, very good. Very good, Nellore. You are right, beta. You are right. Your answer C and D. Perfect, perfect. Very beautiful answer. Getting the point? So that's why 8th cranial nerve, special somatic efferent is 8th cranial nerve. So these are located on the lateral most position. That's why in our beautiful creation of the God, yes, our body, you will observe that, sir, the vestibulocochlear nerve and their nucleus, they are located on the lateral most side. Are you getting? Our topic was this one, sir. The first functional column, gusse. Then second was the bay, bay. They all merged the same point. Can you see the sensory part is here? And then 8th cranial nerve, sassa is lateralmost. Yes, you can observe here the same thing. Fine. So, gusse be gue, gua ba gussa sasa. Fine. Sir, here are the our, yes, gussa, and this is the our sasa. So these are the our presentation. Hope you all are catching the point. So this was the our topic. Now you will learn in your medicine. Yes, you will see in your our brainstem syndrome. So I am just going to correlate with your clinical. Fine. In case of the brainstem syndrome, sir, the cranial nerve will be involved. This cranial nerve nuclei are involved. Fine. So just one summary, sir, the different kind of the, yes, and not medicine. Also you can include the physio and the brainstem syndrome. They are the part of the radiology also. So we are going to do this beautiful anatomy, medicine, physio, and the radiology integration. What I want to tell you, I left the ortho and the pediatric clinical branches just to teach all the subject. I am teaching all the 19 medical subjects since 2009. Okay, so I am teaching this integration since 2009. This is the next pattern which has been just we are hearing since a few years. Okay, so I am going to give that benefit. Yes, that integration here. Sir, anatomy, medicine, physio, and the radiology, beautiful integration. The Harrison, the brain stem syndrome. Okay, so in your brainstem syndrome, you will see the lesion at the what, sir? Midbrain syndrome. Sir, there is our, yes, Ayush Banerjee. I'm using so many English, but in between few Hindi, then there is no. I just this will use in your trick and the mnemonic. Yes, you can ignore easily, no? Because the many students are from the Hindi, so we are using the Hindi plus English. Many students from the English, maximum 99% content they are English. Okay, so don't worry for that. Okay. Yes. So what you have to see, sir, there is a midbrain syndrome, and there is our what? Yes, Pontine syndrome, and there is our what? Medullary syndrome. All kind of the students are there, and we have to make happy to everyone. So many students, they are belonging to the from the north side, they ask for the Hindi plus English, so I am using the Hindi plus English. And maximum students, yes, they are also from the south side, so 99% I am using the English, but 1% few shairis, few songs, and few letters just for the trick and mnemonic. Okay, that 1%, 5% for the north side. So there is no problem. Okay, I have to make happy to all the students. Okay, so don't worry for that. So we are going to talk about the midbrain syndrome, then Pontine syndrome, and then medullary syndrome. Yes. So I told you in the midbrain which cranial nerve? Sir, third and the fourth. Yes. In the pons there is the fifth, sixth, seventh, and the eighth cranial nerve. So easy. Then in our medulla, yes, ninth, 10th, 11th, and 12th cranial nerve. So remember, in midbrain syndrome, there is a damage to the third and fourth cranial nerve. So you will observe in the midbrain, sir, there is a location, there is the our condition like the Perry-Nod's syndrome. Yes, sir. One condition. Also, other is your Benedict syndrome. Yes, sir. That is the your what? Benedict's syndrome. And third is your what? Weber syndrome. So you will see in this situation, there will be the damage to the third and fourth cranial nerve. Never there will be the damage to the 5, 6, 7, 8 or 9, 10, 11, 12. So elegant, so beautiful. Anatomy is just looking like a wow. This is the your integration. This is the integration with your medicine. This is your, yes, Harrison final MBBS. Yes, Pontine syndrome, like the your facial colliculus syndrome, like the, yes, Millard Gubler syndrome. Also you will see one more situation, that is cerebellopontine angle syndrome. The most common cause is the our acoustic neuroma, acoustic nerve related tumor, that is the acoustic neuroma. These are our Pontine syndrome. Getting the point, beta? Yes, sir. So these will affect the nerves, mainly the 5, 6, 7, 8. The cerebellopontine angle syndrome, acoustic neuroma, it is arising from the your 8th cranial nerve. And in the similar way, you will see the medullary syndrome. Sir, there are the our two types of the medullary syndrome. What? Sir, medial medullary syndrome. Also you can say, sir, there is the our lateral medullary syndrome. Getting the point? So medial medullary syndrome, this is also known as the Deserine's syndrome. The lateral medullary syndrome, it is also known as the pica syndrome, because the pica artery is involved. Sir, it was studied by the Wallenberg. That's why you will use the term Wallenberg. Yes, Wallenberg syndrome. This is pica. Pica is the branch of the vertebral artery, so it is also known as the vertebral artery syndrome. All are same. So just try to understand which cranial nerves are located lateral part of the medulla. Sir, this is the beautiful integration. Sir, lateral part of the medulla, there are the our sensory nerve. Yes, lateral part of the our medulla. So there are the our, yes, can you observe again here? Look, observe. Sir, this is the our medulla. Fine. In the our medulla, you will observe. I'm just going to do one beautiful integration, one image. I am bringing here. Sir, this is your image. Can you see? This is your medulla. Yes, it is the your bulb-like part. It is the bulb-like part. So in the medulla, you will observe there is a midline portion. Sir, at the midline, there is the 12th nerve. So if there is a damage to this midline part of the medulla, so this is the medial medullary syndrome. But if there is a damage to the lateral part of the medulla, so in the lateral part of the medulla, mainly which cranial nerve? Sir, there is the our 10th nerve. Yes. So damage to this midline part of the medulla, this is the medial medullary syndrome. It is affecting the our general somatic efferent column of the midline. And you can see the lateral part of the medulla where mainly the 10th nerve in the medulla. So yes, this is our lateral medullary syndrome. The midline part of the medulla, it is supplied by the anterior spinal artery, while the lateral part of the medulla, it is supplied by the your posterior inferior cerebellar artery. So lateral medullary syndrome is due to the posterior inferior cerebellar artery, while the medial medullary syndrome is due to the anterior spinal arteries. Okay, so these are the your different points which you can understand further. Okay, so these are the your beautiful integration, the our midbrain syndrome, the medial medullary syndrome and the lateral medullary syndrome. So this was the topic, and at the final we are going to, yes, revise. So at time of exam they will ask the question, don't get confused, just 1-2 times you have to revise with the concept. For the first MBBS students, it is mandatory to watch the first video, and if you are senior, you are having the basic concept clear, then just go for this video. Okay, sir, there are the our question. So I am going to write down the final mnemonic. What you have to remember, sir? The sequence. What is a sequence? Final revision. Yes, final revision. Quick answer. Fine. So answer is gusse, then be, then gue, then gua. Yes, it is fusing with the ba. So gua and ba, they are fused together. Gua ba, then gussa, and then seventh column is developing, that is the sassa. So how many columns are there? 1, 2, 3, 4, 5, 6, 7. Okay. So try to understand gusse, be, gue, gua, ba, gussa, sassa. Fine. So total 7 columns are there. So at the end of the day, what you have to remember, sir? One beautiful concept. Just break the name and think about it. गुस्से, गुस्से में आंखें और जीभ दिखानी है. So you have to remember the eye and tongue. So just tell me it is efferent. So what cranial nerve? For the eye, 3, 4 and 6. Agree beta? And for the tongue, you have to say 12th cranial nerve. Simple. So simple. रटना ही नहीं है बेटा. Yes, it is very easy. Very easy. Then, yes, branchial efferent means your trick is pharyngeal apparatus. Just tell me the cranial nerves of the pharyngeal apparatus. Sir, the mandibular nerve, first arch, then facial nerve, second arch, then glossopharyngeal nerve, third arch, then vagus nerve, fourth arch, and vagus nerve is assessed by the 11th nerve. Yes. So this is nothing. This is the nucleus ambiguous. Yes, sir, complete. Now the general visceral efferent. I told you the mnemonic. Left, S-I-D-E. Yes, L for lacrymatary nucleus, S for superior salivatory nucleus, I for inferior salivatory nucleus, D for dorsal nucleus of the vagus, and E for Edinger-Westphal nucleus. So simple. Yes, if you want to tell about the cranial nerve, then lacrymatary nucleus is related with the facial nerve, superior salivatory with the facial nerve, inferior salivatory with the glossopharyngeal, dorsal nucleus of the vagus, 10th nerve, and the Edinger-Westphal nucleus, it is related with the our third cranial nerve. So simple. Yes, these are our parasympathetic ganglion. Now this is our, yes, general visceral efferent and branchial efferent. So only one structure in our body which is having the both kind of the properties, sir, that is the our, yes, tongue. What you will say, sir? That is a tongue. So remember, what about the our tongue, sir? This is related with the afferent, means sensory. So nucleus tractus solitarius, which is carrying the taste pathway. So N for 9, T for 10, S for, yes, 7. Simple. And then general somatic afferent. So sir, this is our sensory nucleus of the trigeminal nerve. So what you have to say, sir? Our sensory part of the trigeminal nerve, it is having the 3 nucleus. Do you remember? Mantu, Cantu and Santu. Simple. And special somatic afferent. If you are talking about the nucleus, then yes, only the 8th cranial nerve nucleus. But if you are talking about the fiber, then first and second also. So remember, first and second, these are having no nucleus. No nucleus. Okay. So this is the summary. Yes, sir. So I'm just making the one beautiful summary. इससे ज्यादा बेटा कुछ नहीं पढ़ना है, इतना ही करना है और बार बार करना है. I told you all the concept, then I created the mnemonic also for all of you. Agree? And here is your nucleus tractus solitarius. Yes, you can observe the fifth cranial nerve nucleus, Mantu, Cantu and Santu, and this is your special somatic efferent part. Okay, so these are the your different points. So this is all about our today's class. Please ask if any doubt is there, beta. Please ask if any doubt. I'm just making the beautiful notes for all of you. Yes, sir. Please ask if any doubt is there. This is the your revision. This is your summary. Only these points you have to revise again and again. Okay. So this is your final revision. Okay. So thank you very much. So this is the one of the very difficult topic, but very interesting. Now you all are having the proper understanding why these cranial nerves are having the one particular arrangement. Okay, fine. So at the last, remember, जिसको जो कहना है कहने दो, अपना क्या जाता है, ये वक्त वक्त की बात है और वक्त सभी का आता है. So the same line which I told in the your yesterday class. Yes, remember बेटा, always focus on your target. कुछ देर की खामोशी है, फिर शोर आएगा, औरों का तो वक्त आया है, हमारा दौर आएगा. Remember बेटा, target, focus on your particular aim and work for that. Definitely you will crack everything. Okay, so these all are the different concept for all of you. रहने दे आसमां जमी की तलाश कर, सब कुछ यही है, कहीं और नहीं तलाश कर. हर आरजू पूरी हो तो जीने का क्या मजा है, जीने के लिए कम से कम एक कमी की तलाश कर, एक कमी की तलाश कर. सो विद दिस ब्यूटीफुल लाइंस, थैंक यू वेरी मच. गॉड ब्लेस यू ऑल. Okay, we will meet soon again. What topic you need, please comment at this below part. Okay, you can comment at the comment section whatever the thing you require, you can do now. Okay, so thank you very much. God bless you all. Ending the session. All the best.